deregulated environment. If you can go from to a deregulated environment, that means you're then able to access...
And transitioning from a discipline structure, engineering, project management to more of a care sector or a care economy, you gave the difference of the workforce was one, but how did you go through the first 1 year to 6 months in terms of grasping what's happening in the sector, because it's a fairly complex environment in terms of legislation, regulation, and compliances?
What a journey aged care is on. Okay, I joined what is now Bethany back in 2000, and so we just had accreditation come into the sector. So you began to get that structural change happening. If you're to really step back, what is happening in aged care? Okay, there is no way the government can afford aged care going forward as more and more people get into the age bracket of requiring aged care. There aren't enough taxpayers in this country. So having the government pay for everything to do with aged care is not real, because it's not going to be able to support it. The budget wouldn't cope. So through a process over a number of years, you're going to have that structural change where you go from a totally regulated environment to a more deregulated environment. If you can go from to a deregulated environment, that means you're then able to access more resources to be able to provide the care. In other words, user pay. Those that can afford to pay should be able to pay. Those that can't afford to pay, the government should pay. So where are we at right now? We have a situation where at the end of last year, we had supply deregulate. So we had no more allocation of places. The government said to providers, you can build wherever you want. That's supply deregulating. If we look at price, at the end of last year, we had partial price deregulation. We still had the federal government funding care. We have ANAC in place, and the government believes, and rightly so, that it should be able to pay for the funding of all the clinical care requirements for residents in, residential aged care. But through the whole of your life, you've paid for your own accommodation, either a mortgage or a rent. You've paid for your laundry, you've paid for your food. And so that component has now been deregulated. If, based on your wealth, you either do or you don't pay. So we're getting into a space now of deregulation of supply, partial deregulation of price, which is forcing the sector now into structural reform. It is good news. It means that we're going to be able to look after the elderly going forward, even as more people, age and get into, the bracket of requiring care, because it's now not just the government, it's now government and user pay.